Hi guys, Dr. Jamie Jo back here, and today we are going to talk about everybody's favorite subject, math, and how I have to use it every day. I'm just one of those weird people that actually does like math, and I will talk about how in dentistry, why I have to use it, how I have to use it. So the biggest thing is, what is one thing that I do with patients every day? I get them numb. So what that stuff is called, what the sleepy medicine, the sleepy juice is called, is anesthetic. So there's lots of different kinds of anesthetic. Kind of the tried and true standard anesthetic we use today is called lidocaine. Now a lot of people still in their head call it Novocaine. Novocaine has not been used for years and years and years. They stopped using that stuff far before I was born. Now people will still say Novocaine. It's what we use today is still similar to Novocaine, but a lot of people actually had allergies to that. So that's why it's important when I have a patient come in that says, I'm allergic to Novocaine. They may have had an allergy to Novocaine years ago, but an actual allergy to any anesthetic nowadays is not very common. Probably the most common thing I hear when I numb people, or if someone comes and says, I have an allergy to this one, and I ask them, well, what was the reaction? Because a true allergic reaction is being itchy, a rash, not being able to breathe. So what I typically will hear from patients who think that they are allergic to a dental anesthetic is, well, my heart races. The reason that their heart races when they have that in there, which is very normal, is because there's an extra ingredient in there called epinephrine. And what that does is it just concentrates it's in our blood so the patient can get very profoundly numb and not feel anything. Typically the racing heart, they feel it for the few first minutes and it eases out of their system. And that part of it burns off right away. So, very important to ask that question because again, I still have never had a patient with a true allergy. And I will have patients that come in and say they're allergic to all kinds of things. And when I ask what the reaction is, it's actually a normal side effect of the medication, not an actual allergic reaction. So that's also just very important. So the reason why we're talking about dental anesthetic specifically is because I have patients who are babies, and I have patients who, probably my oldest patient right now is probably 94, 95 years old. So I have to take into account the patient's size. I have to take into account the patient's, if they have any medical issues like their heart, because again, it's got that extra ingredient in it that can make their heart race. So I have to be careful on how much of that I use. We're really going to just focus on the patient's weight today. So I'm going to give you an example. We're going to talk about how the manufacturer, which is the person, not the person, but the company that makes certain medications. So we're going to talk about anesthetic, and they have recommendations that they have on their insert when they send it to us. Those are not necessarily the recommendations that we follow. We actually are a little bit more stringent on, in the dental world. We actually tighten that recommendation up, and we actually err a little bit more on the safe side because we don't want to administer too much, especially in a child. So we are going to focus on a child today, and I'm going to show you how we actually have to figure out in our head, okay, how much numbing medicine can I give one child? So that's why when I see kids and they come in and they need all kinds of work done in their mouth, I can't typically sit down and just do all that work in one day. It's too stressful on the patient. And it's just, I can't use that much numbing on them. They could have reactions and just have issues. So we like to kind of stick to one area in a child, especially because the numb feeling, which some of you have probably felt before, is very weird and funny. And it's really hard not to bite your tongue or not to bite your lip. And then you can have a whole different problem afterwards. Once you're not numb anymore, if you bit your tongue or your lip, it hurts. So then you're dealing with that, let alone whatever dental work you got done. So I am going to go get a carpule of anesthetic. I want you to see what it looks like, and then we're going to go through the math and talk about how we actually figure out how much we can use. All right, guys, so again, sorry for the shaky hand, but here is, so this is what a carpule of anesthetic looks like. So lidocaine, 2% with epinephrine, this is about how big it is. So this is probably one of the biggest things in dentistry. See how right by my fingernail it says 1.7 milliliters. So depending on your manufacturer, it may say 1.8 milliliters, which is probably not important maybe for one carpule of that. But if I'm using 4 and 5, obviously that little bit of difference changes things. But we're going to do our math today based on if this was a 1.8 milliliter cartridge. So I want you to look on the top left. So this is, again, multiple different kinds of anesthetic. We're just going to focus on this one. So this is 2% lidocaine with 1 to 100,000 epinephrine in it. The maximum dose, that means the most I can give, is 4 milligrams per kilogram. Now granted, we don't really focus on kilograms too much in America, but it is important to know that math. But then the maximum dose for pounds is 2 milligrams per pound. And then the max total dose, meaning we totally cannot go over that, is 300 milligrams in general. This is for a child. So there's 36 milligrams in one of the cartridges I just showed you. So I'm going to show you the math formula, and we are going to use an example of a 30-pound child, and I'm going to show you how we come up with how many of these we can actually use on them. All right, so we start out with the maximum dose. We're doing it for pounds. Milligrams per pound, and if you remember from that chart, that was 2. Again, this is for a child. Then multiply that by the weight of the child, and that will give us the max total dosage that we can give that patient. So look at the bottom. The maximum dose, milligrams per pound, was 2, times the weight of the patient was 30 pounds. So that equals the max total dosage that we can give them, so that's 60 milligrams. So we're trying to figure out, how many is that again? So we literally take the max total dosage in milligrams divided by how many milligrams are in that one cartridge. So again, we talked about it was 36 milligrams in that 1.8 milliliter cartridge. So we take the 60 milligrams from the other math problem and we divide that by the 36 milligrams that's in that carpule or cartridge, and it equals 1.67 cartridges. So I can use about one and a little over a half of another in a 30-pound patient, and that is all the numbing medication I can use on them of that particular kind of numbing medicine. Okay, so the next math problem we're going to talk about is actually taking money, figuring out what to charge, looking at the patient's insurance. So I'm going to explain it as simple as I can, and dental insurance and insurance in general is very confusing. But I just kind of made up some prices over here. So you can see cleaning 100, exam 50, fluoride treatments 40, x-rays are 75, and just a filling is $200. So we're going to look down here, and these are the patient's insurance benefits, and this is what it means. So preventive, which would mean anything that they're doing for prevention, which is the cleaning, is 100% covered by insurance. So that means the patient will pay nothing, their insurance will pay it. So the next one down is restorative or fillings are 80% covered. That means if they need a filling at $200, it will only be 80% covered, and the patient would owe 20% left over. So 80% of a $200 filling would be $160, so the patient would owe $40 out of pocket for one filling. Fluoride is 100% covered, but only if the patient is considered a child, so that's under 21 years old, and then their x-rays are 100% covered. So I came up with a little word problem up here, and if you want to pause it right now, you can, but I'm going to read through the word problem, and then I'm going to help you guys with the answer. So you can just see how much we obviously have to use math, and not just me, but my front desk people, the people that answer the phone and take all the money, they're the ones that do that. All right, so 30-year-old patient has already had one cleaning appointment earlier in the year. At that appointment, the patient had a cleaning, a set of x-rays taken, an exam done, and a fluoride treatment. The same patient just had their second cleaning of the year done, which included a cleaning and exam. No x-rays this time. The patient now needs 5 teeth filled. Assuming that the teeth that need filled have the below price, and with the $1,000 insurance maximum per year, how much money does the patient owe after the dental insurance pays for their treatment? So that's also the one thing I didn't say, was that we're saying that the insurance will It'll cover all this stuff and portions of it, but only up to $1,000. So we need to figure out, number one, how much the patient would owe anyway, because the fillings are not 100% covered. And what else isn't covered? That fluoride treatment, because the patient is 30 years old. So we are going to break that down and go through it, but you can pause right now to see if you guys want to kind of try the math on your own first. All right, so here we go. We'll walk through it. So 2 cleanings in the year, $100 each. So $200 for the cleaning. Exam, 2 exams a year, so $50. So $100 total because 2 of them were done. So we already said the fluoride is not covered and the patient only got it once, so that's $40. So they already know they're going to owe that. The x-rays were $75. Those were taken once. And then the patient needs 5 fillings, so $1,000 worth of fillings. But again, insurance will only cover 80%, so that's $800. So already the patient will definitely owe $240 out of pocket. But I believe that the patient went past their $1,000 maximum. So we'll break it down again. Fluoride was $40, remainder of fillings is $200, so patient will owe $240, but the patient's insurance maximum is $1,000. What else does the patient owe? So what was the overall total again? $1,415. How much over $1,000 is the total? $415. So we got to the $415 because the rest of the treatment was not covered because they reached their maximum limit. So I bet you guys are smart and some of you guys got that. Again, insurance is very confusing and this was actually a very simplified version of it. It gets even worse and more confusing after that. But again, that's why math is super important, because if we miss some of these things and don't realize there's a maximum and we tell the patient, hey, this is going to cost this much, and they get it done because of the estimate we gave them, and that's our fault if we messed up, we end up having to write that off. So that's something like money we can't collect if we're not on top of all the little nuances of their insurance. So today, I think one last thing just to touch on that probably you guys have experienced at some point is antibiotics. I actually write a fair amount of them to treat dental infections, but of course, I still have to take into account the patient, the weight more than anything. So once a patient reaches being an adult weight, really all the amounts and the dosages don't really change. It's in children. So that's something that we always have to calculate as the doctor prescribing it, and that's something a lot of times we'll double check with the pharmacist if we're kind of confused on something. And again, the other kind of real world problem again is an allergy to the things I'm using. If it's typically I'm using something that I really prefer, a medication I really prefer, and it's the one that really needs to be done, but the patient tells me, that they can't breathe if they're taking it. Well, I obviously can't give them a medication where they can't breathe. So there's some alterations I have to make to that, and I just have to be very, very mindful, always checking the chart, always asking the patient if they have new allergies, even if I've been seeing them for years. So those are things that I kind of have to alter my plan. And of course, different medications have different dosages. So you have to figure all that out and use your math skills. All right, so we have one more session after this. Thank you for listening. We're going to get a little bit messy in the next one.